Good morning. My name's Casey Isom. I am a plastic and reconstructive surgeon in Logan, Utah, and I'm here this morning to talk about breast cancer reconstruction. This is a format that I'm not very familiar with, Facebook Live. This is the first time I've done this, and to be honest, I was a little hesitant because I like to do this sort of thing one-on-one in the office. But I have been surprised by the number of women I meet who had breast cancer and had a mastectomy and didn't realize that reconstruction was an option. Many people think that insurance won't cover it, or it's a cosmetic procedure, and they're concerned about costs. Also, many women just aren't aware that it is available. So I thought in order to reach as large of an audience as possible, we would do a Facebook Live. And also this month is a big push in the United States to make women aware of the importance of breast cancer screening, breast cancer treatment, and breast reconstruction. So in light of all of that, I'm here to answer any questions you might have about breast cancer reconstruction and to just give a very basic overview of what that entails. One thing that we're very fortunate to have here in Logan, Utah, at Logan Regional Hospital, is a team of excellent breast cancer surgeons. They are very caring, they're very skilled, they're very competent and compassionate. And those surgeons I work with from the time of mastectomy until the treatment is done, and then I continue that treatment until the reconstructive process is done. So it's a team effort, and one that gives the best clinical results as far as curing cancer and the best functional and cosmetic results as far as your long-term result. Once the breast cancer is cured, we can then have you look and feel as good as possible. So if we think about breast cancer, first of all, if you've had breast cancer, I'm sorry, it's an awful news to have to receive. It's scary, and when patients receive that news and after they've talked with their breast cancer surgeon, they will typically send you to come and see me and talk about reconstructive options before any surgery has even been done. That way we can talk about whether the reconstruction could begin at the time of mastectomy, or if it's something that we would delay and do later on. But in that meeting we'll talk about options, and that's the great thing about reconstruction, is there are great options to have you look and feel your best after you've beaten the cancer. So that process starts typically at the time of the breast cancer surgery, or what's typically a mastectomy or even a lumpectomy. With the mastectomy, I am operating with the general surgeon in order to optimize the cosmetic results and reconstruction results once we're done. That operation is done hand in hand, and we give the best possible result, in my opinion, by working directly with the breast cancer surgeon or general surgeon. So once the cancer has been removed, typically we'll start that reconstructive process. And when we think about breast reconstruction, there are three basic options for recreating the breast mound. The first is with a breast implant. The second is using your own tissue plus an implant. And the third is using your tissue only. There are advantages and disadvantages to each, and typically we'll sit down and discuss in great detail what all of those entail. But to summarize, breast implant reconstruction is the most commonly chosen method of reconstruction in the United States. It's typically the most straightforward and a bit less invasive than some of the other options. And with modern breast implants, we can get very nice results. The nice thing about the newer breast implants, they're a highly cohesive or gummy bear type gel. It is a silicone gel that is safe, and it has been cleared by the FDA. We've been using these types of implants for many, many years in the United States and worldwide with excellent results. Typically, along with that implant, we'll also do something called fat grafting. Sometimes you see that advertised as a natural breast augmentation. Basically, we're transferring fat cells from one part of the body to the tissues surrounding that breast implant to give a more soft and natural looking result. And so with using your own fat and also an implant, that's a very common way of doing a breast reconstruction. Sometimes in the case of a reconstruction or lack of good soft tissues remaining after a mastectomy, we need to bring in healthy tissue from another part of the body. That can be done with what we call local flaps, where tissue is transferred typically from the back to the front and then combined with an implant to provide a reconstructed breast. The third option would be using your tissue only. Typically that's done with tissue taken from the lower abdomen that is transferred to the chest, and usually tiny vessels are sewn together in the chest to provide blood flow, and that way tissue can be moved from different parts of the body to reconstruct the breast. So there are great options available, and all will give good, long-lasting results. And I think that's the really positive thing about this whole process is, as a plastic and reconstructive surgeon, we're able to take an injury or a defect after cancer reconstruction and restore the form and function and make things just as good as possible, both the way they look and also helping to restore a patient's and a woman's sense of self and femininity and well-being. And that's a very, very satisfying thing to be able to do as a reconstructive surgeon. So I appreciate you spending time this morning and learning more about breast cancer reconstruction. If you have questions and would like to discuss this further, I'd encourage you to call our office anytime, and we'd be happy to sit down and meet with you and discuss more. Breast reconstruction can happen even if a mastectomy has been done years ago, and many women who maybe tried to wear a prosthetic or other method of trying to look symmetric in clothing, if that's not working out, then reconstruction can still be done in a delayed fashion. Many times after a reconstruction there might be things that are bothersome about the reconstruction, and with new techniques, especially fat grafting and other techniques we can take a reconstruction that maybe was done 10 or 20 years ago, and the results now maybe aren't optimal, and we can revise that and make things look and feel better with newer techniques and newer materials that we have available. So this is something that can be done at most any time in this whole journey of cancer survival. So for those of you who have been diagnosed with breast cancer and have fought it or still fighting it, stay strong. We will do everything we can to help you get through this difficult time, and we would appreciate to help in any way that we can. So again, thank you very much for your taking time to educate yourself about your options. Thank you.